Hi students, in this video we shall discuss about blood groups and blood typing from the lesson Body Fluids and Circulation. When blood from two individuals is mixed, sometimes clumping or agglutination of RBCs occur. This clumping is because of the immunological reactions. Why clumping occurs in some cases and not in other cases, it's a mystery until the discovery of the blood groups by an Austrian scientist, Karl Landsteiner, in the year 1901. More than 20 genetically determined blood group systems are known today, but Landsteiner discovered two blood group systems called the ABO system and the RH system. These two blood group systems are the most important ones that are determined before blood. ABO system is based on the presence or absence of antigen A and antigen B. Blood is divided into four groups: blood group A, B, AB, and O. The determination of ABO blood groups depends upon the immunological reaction between antigen and antibody. Landsteiner found two antigens on the surface of RBCs and named them as antigen A and antigen B. These antigens are also called agglutinogens because of their capacity to cause agglutination of RBCs. Clear children, antigens are also called agglutinogens. He noticed the corresponding antibodies or agglutinins in the plasma and named them antibody A and antibody B. However, a particular agglutinogen and the corresponding agglutinin cannot be present together. If present, it causes clumping of the blood. Based on this, Landsteiner classified the blood groups. Landsteiner stated certain laws, children, that is, if a particular agglutinogen, that is antigen, is present in the RBCs, corresponding agglutinin, that is antibody, must be absent in the serum. Clear children, if antigen is present, antibody will be absent. If a particular agglutinogen is absent in the RBCs, the corresponding agglutinin must be present in the serum. Clear children? How do we determine a blood group, children? If you belong to the blood group A, you have antigen A on the surface of your RBCs and antibodies B in your blood plasma. Clear children? If your blood group is A, you will be having antigen A and antibody B. If your blood group is B, you will be having antigen B on the surface of your RBCs and antibodies A in your blood plasma. So if your blood group is AB, then both the antigens are present. A and B antigens are present on the surface of your RBCs and no AB antibodies are present in your blood plasma. Clear children? And if your blood group is O, then you don't have both A and B antigens on the surface of your RBCs, but you have both A and B antibodies in your blood plasma. Clear children? Once again, if your blood group is A, the antigen on the surface of the RBCs will be A and the antibodies in the serum will be B. And if your blood group is B, antigens will be B and the antibodies will be A. And if your blood group is AB, antigens A and B are present but no antibodies. If your blood group is O, both the antigens are absent but you have A and B antibodies. Now, what is the importance of ABO groups in blood transfusion? During blood transfusion, only compatible blood must be used. The one who gives blood is called the donor and the one who receives the blood is called recipient. While transfusing the blood, antigen of the donor and the antibody of the recipient are considered. The antibody of the donor and the antigen of the recipient are ignored mostly. Thus, RBCs of O group has no antigen and so agglutination does not occur with any other group of blood. So, O group blood can be given to any blood group persons and the person with this blood group are called as universal donors. Clear children? And the plasma of AB group blood has no antibody. This does not cause agglutination of RBC from any other group of blood. People with AB group can receive blood from any blood group persons. So, people with this blood group are called universal recipients. Apart from ABO blood group, even RH factor plays an important role, children. RH factor is an antigen present in RBC. This antigen was discovered by Landsteiner and Wiener. It was first discovered in rhesus monkey and hence the name RH factor. There are many RH factors but only the D antigen is more antigenic in human. The persons having D antigen are called RH positive and those without D antigen are called RH negative. Among Indian population, 85% of the people are Rh positive and 15% are Rh negative. Percentage of Rh positive people is more among black people. Rh group system is different from ABO group system because the antigen D does not have corresponding natural antibody. However, if Rh positive blood is transferred to Rh negative person, antibodies is developed in that person. On the other hand, there is no risk of complications if the Rh positive person receives Rh negative blood. So, the person who possesses Rh antigen on the surface of RBCs is said to be Rh positive, and the person who lacks Rh antigen on surface of RBCs is considered to be Rh negative. This Rh factor leads to the disease in fetus and newborn. We call it as hemolytic disease, which is characterized by abnormal hemolysis of RBCs. It is due to the Rh incompatibility, that is the difference between the Rh blood group of the mother and the baby. Hemolytic disease leads to erythroblastosis fetalis. Clear, children? Erythroblastosis fetalis is a disorder in fetus characterized by the presence of erythroblasts in blood. When a mother is Rh negative and the fetus is Rh positive, the Rh factor being inherited from the father, usually the first child escapes the complications of Rh incompatibility. This is because the Rh antigen cannot pass from fetal blood into the mother's blood through the placental barrier. However, at the time of parturition or delivery of the child, the Rh antigen from fetal blood may leak into mother's blood because of placental detachment. Rh antibody which enters the fetus causes agglutination of fetal RBCs resulting in hemolysis. Severe hemolysis in the fetus causes jaundice. To compensate the hemolysis of more and more number of RBCs, there is rapid production of RBCs not only from bone marrow but also from spleen and liver. Now, many large and immature cells in the pro-erythroblastic stage are released into the circulation. Because of this, the disease is called erythroblastosis fetalis. Clear, children? I hope you have understood the concept of blood grouping and blood typing. See you in the next video. Thank you.